And the CDC Advisory Committee is expected to vote this morning on whether newborns should get the hepatitis B shot. Committee members delayed the vote yesterday after disagreements and confusion over voting language. Now they could potentially reverse a public health policy that's been in place for more than 30 years. ABC's medical contributor, Dr. Alok Patel, is here for more on this. Hi, Dr. Patel. So what's fueling concerns over the Hep B shot and then the confusion over this voting language?
And the confusion is really stemming from the wording of the language, and it seems like it's rooted more in policy and a big argument about the timing of that first dose. It's important for people to understand that this argument was not fueled from anything related to the safety of the hepatitis B vaccine or its efficacy. And I think a little bit of confusion right there is what's causing people to kind of raise their hand and say, why did they actually go forward with this vote? And we haven't seen any data put out about why they even went forward with this recommendation, but we did hear from committee members that this is the third time in 72 hours the wording has changed, and that is the reason for the delay. They wanted more time to read and thoroughly review what was being proposed.
Dr. Patel, during the meeting yesterday, there was a lot of comparison to Denmark, where the vaccine is not recommended for infants. What do you make of that?
I make of this as cherry picking what certain countries are doing. And this seems to be a common tactic when people are really looking at our childhood vaccine schedules. They say, well, hey, Denmark does this or Japan does this. But there's 115 or 16 other countries who do have a universal recommendation for hepatitis B. And also, Diane, we aren't Denmark. We're a larger country. We have a diverse population. We have gaps in healthcare. We have 35% of counties with no maternity care, millions of people who don't get prenatal care. We have children. We have families who don't have primary care. So we have a lot of these issues that they don't necessarily have in Denmark. So it's really difficult to compare one little checkpoint with the vaccine schedule and not all of healthcare policy that allows there to be more follow-up and more screening in Denmark compared to the United States. So it's not a fair comparison at all.
And big picture, if the panel decides to delay or no longer recommend the birth dose, what does that mean for American children and their parents?
What that potentially means is massive gaps in coverage and potentially a lot more children getting hepatitis B. And we know from the data that when young kids get hepatitis B, there's about a 90% chance they'll develop a chronic infection. We actually heard at the ACIP meeting from a physician on commentary about how she developed hepatitis B as an infant, and they didn't actually know where the source came from because it's so incredibly contagious. This was actually the policy before 1991, and thousands of cases were missed. The labs are not perfect. There's gaps in prenatal care. There's gaps in follow-up, and cases do get missed. But it's important for people to remember that since 1991, when we got a universal recommendation, cases of hepatitis B in this country have dropped from 95 to 99%. Hundreds of studies recently were pulled together and reviewed to show that this shot is extremely effective and it's very safe. And moving that goal line can put a lot more children at risk when they don't need to be.
All right, ABC's medical contributor, Dr. Alok Patel, thank you.